Someone who has a reproductive health condition or chronic reproductive health condition is likely to have 4 other comorbidities that are not even related to the reproductive organs because of the inflammation, because of the hormone imbalances. I had blood transfusions, iron infusions, I've had 4 surgeries now. All of that could have been treated if someone had actually investigated those symptoms when I was 14 years old. Really unfortunate.
I think this falls under the bracket of invisible illness, right?
In 2022, only $2 per woman with endometriosis was going towards research on that condition.
Natalie, it's a pleasure to be here with you today. So excited, such amazing conversations we're having. And your piece has been missing. Women's health, fertility, PCOS, endometriosis, these autoimmune conditions that are so understudied and misdiagnosed. So excited to be here with you. Thank you.
Thank you for having me, Caitlin. I'm really excited to talk about this because I think it really does fit into the MAHA movement.
Absolutely.
We've talked a lot about chronic illnesses and the chronic disease epidemic, especially among young children, but chronic reproductive health conditions is part of that story, and it's something we really need to pay attention to. Mm-hmm. And I like to think that every system of the body is interconnected to function for procreation. That's what our species has to do to continue. And so that procreation step, the reproduction of our species, is so important, and preserving and restoring fertility is incredibly important.
And we've come so far from that, really, from that main goal, and from realizing why we're on this planet, what our ancestors were here to do, why we're actually here. Natalie, just walk our viewers through a quick background on you, yourself, why you're involved. And
I'd love to, yes. I have a very common yet unfortunate experience. I started developing symptoms of reproductive health conditions in my early teen adult years, and unfortunately had, like I said, a very common experience when I presented to a medical professional with those symptoms. They gave me 2 options: hormonal contraception to mask the symptoms of the reproductive health conditions, or pain management like OTC, ibuprofen, Midol. And so for the Band-Aids, exactly. So for the next 11 years, I took ibuprofen around the clock for 7 to 10 days of every month. Incredibly unhealthy, but it's the only way I could function. And even then, even with ibuprofen, nonstop, 800 milligrams, I was in extreme pain. There were days I couldn't get out of bed, days where couldn't leave the bathroom. And this is a little bit intimate, but I was bleeding so heavily that there were days I couldn't even leave my house. And nobody took me seriously. No medical professional actually wanted to investigate those underlying symptoms and reproductive health conditions until my hemoglobin dropped so low that I was severely anemic, and my hemoglobin was a 5. And finally, a medical professional decided to investigate those symptoms. I had blood transfusions, iron infusions, I've had 4 surgeries now. All of that could have been treated if someone had actually investigated those symptoms when I was 14 years old and presented to a doctor.
Yes, and all of these conditions, you would think women are at least half, if not more, of the population. Yet all of these conditions are so understudied. There's not enough research.
Really understudied.
And we do blame the physicians, but half the time it's not their fault because none of this is talked about.
They're not trained in medical schools or in residency programs. They know very little about the female body. There's very little research on reproductive health conditions like endometriosis. In 2022, only $2 per woman with endometriosis was going towards research on that condition. We don't know what causes endometriosis. We don't know how to effectively treat it other than through minimally invasive gynecological surgery.
Or even diagnose it.
Or even you can't diagnose it without a laparoscopy. And you can't find it on imaging. So it's this condition that is almost untreatable because medical professionals have never been trained to treat it. And it's really unfortunate. And it's the same within the whole reproductive health care system. This is true for adenomyosis. We don't know what causes adenomyosis. We don't even have a treatment for adenomyosis right now. So it's really unfortunate.
I think this falls under the bracket of invisible illness, right? And how many of us women have been so sick in such severe chronic pain to be told by a doctor, well, you look fine.
Yes.
Or you look healthy.
It's all in your head. Yes. You're being hysterical.
Yes.
Hysteria. That's really what it has been throughout history. And it's so unfortunate because there is real pain there, but women are not taken seriously.
So Natalie, walk us through, and I as a female, I'm so curious, what are the best sources right now to find good help, good health care, whether that's holistically, traditionally? Where does a young female go when they're that desperate, because we've been there, and you don't know where to go to for the answers.
Yeah. There is a branch of medicine that's been carved out to really treat these reproductive health conditions. It's not part of mainstream medicine because mainstream medicine won't take it seriously because it doesn't offer pharmaceutical band-aids, but it's called restorative reproductive medicine. And what it does is basically what the terminology is. It restores the functions of the human body so that it functions the way that it was designed to function. And so that's through hormonal balancing, so bioidentical progesterone in some cases for women that have PCOS or endometriosis, metabolic and lifestyle changes, so eating an anti-inflammatory diet for someone that has endometriosis. And then also medical professionals that are trained in minimally invasive gynecological surgery so that they can do wedge resection surgeries for women with PCOS or laparoscopic excision for women with endometriosis. It's really comprehensively looking at the whole body and identifying the different parts of the body that could contribute to infertility or reproductive health condition. And that's where male infertility comes in. And I don't want to just focus on female infertility because male infertility, that factor is just as important.
And rising.
And well, infertility just across the board is rising, reproductive health conditions are rising. So we need to, for couples that present with infertility, especially if it's the male and the female, we need to look at both factors and understand how comprehensively their bodies could contribite to infertility. That's not done in mainstream or conventional medicine.
No one is
very
looked
lacking.
at a whole person. You go to the doctor and they give you a Band-Aid and they treat the symptom and they tell you to come back in 6 months.
Yes.
Hormonal birth control. We've come a long way. It has been a daunting road, but I can speak for my contemporaries and the generation coming up behind me, which is the Gen Zers. And these women are asking questions finally.
Yes.
They are doing their own research and they are saying no to hormonal birth control. They are coming off of it in droves, record numbers now. Walk our viewers through that journey in this conversation.
Historically, 65% of women of reproductive age have been on hormonal contraception, but there's now a movement, especially on social media, of women sharing their experiences and their side effects. Higher rates of depression. Women who get off birth control are no longer attracted to their spouses.
Wild.
Women who have just had devastating experiences of fertility loss with hormonal contraception. And so people are talking about this now. They're questioning, hey, is hormonal contraception actually causing infertility? Is it aging my ovaries? Is it aging my reproductive organs? Am I functioning differently because it's messing up my hormones? Am I not as good of a person, or am I not acting the way that I feel like I should be acting because I feel crazy in my head constantly? And so women are really questioning, which is a wonderful way to see that this is a new generation talking about their healthcare, wanting to be in touch with their fertility, wanting to be in touch with their bodies, which is incredibly important. And I think that this is a movement that we've needed for a long time. Women should be able to understand their bodies, their cycles, and their fertility to make informed decisions. Informed decisions is really crucial here, to make informed decisions about what they're putting in their body, the medication they're taking.
And to have that knowledge.
Yes, and to understand
power.
Fertility planning. We like to talk about that a lot in the space that I work in. Understanding how future fertility will work and how you can plan for that future fertility. Even if you're not even thinking about children yet, but if you want to be a mother someday, if you want to have children, you should be thinking about that ahead of time and planning for that.
What would your number one piece of advice be to young women out there that are just starting to learn about their hormones and hormone balancing and women's health and looking at the body as a whole? What would your number one piece of advice be?
Learn how to cycle chart. And I don't mean just take a period app and put in when you're having your period into your phone. I mean track your basal body temperature, track your hormone fluctuations, track your cervical mucus, understand how your body works. That's really important. At 13 or 14 years old, we should be teaching women through school programs, through your parents. You should be understanding how your body works. It is a dream, but it's a dream that I think could be a reality if we kind of shift our mentality about women's health.
Yeah, I want to talk to you about that. That leads me to my next question. As far as your goals, we have a new administration of disruptors, and we're having these conversations, Natalie, on a national level. What do you see as the few goals that we have and the journey that we have in front of us over the next few years? What needs to get done? What are the top priorities?
As a patient, I was able to identify a lot of the gaps that I saw, and now I've seen medical professionals who have identified their gaps of how they access these patients and how they access funding and availability for treatment. So the three things that I've really identified is a gap in general education. So, like I said, women being educated about their bodies, men being educated about their bodies. There is a federal role, there's a state role in that. So there are health programs that exist within HHS and all of the departments of HHS that really functioned towards educating young people about their bodies and about their sexual health. You could integrate restorative reproductive medicine and cycle charting into those programs. On the medical education side, like I said, most medical professionals are not taught cycle charting, not taught how the female body works in their medical schools or residency programs. There's not as much of a role for the federal government there, but there's definitely a change that needs to happen. And that might be through incentives from the federal government. Mm-hmm. And then also, and this is the piece that really is important for potentially the NIH, and that's to create grant programs for these medical professionals to access for research, yes, to research these reproductive health conditions, to research effective treatment, to understand how our bodies work in a metabolic way that could really change the outcomes of these women and their fertility and these couples. And so those are the three really big gaps that I've explored and discovered. There's an insurance piece to that I won't get into, but most of these medical professionals are not getting proper insurance reimbursement for the care, and these patients aren't getting reimbursement. And so there is discussion about, maybe there's an insurance bundle, or maybe we can think about ICD and CPT codes, which gets into a little bit of detail. But right now, there's really an incentive to pharmaceuticalize, I'm making that word up if it doesn't exist, pharmaceuticalize reproductive health care, put women on hormonal contraception, and then potentially, if they accidentally get pregnant, abortion. And if they can't get pregnant, then assisted reproductive technology. Right. It's actually like a downstream effect of hormonal contraception. And we need to be thinking about that seriously and thinking about is that the way that we really want to function as a reproductive health care system?
Of course, the incentive piece, and then the lack of education piece. And we have an entire generation and an entire class of women that is now seeking treatment with holistic doctors and non-traditional medicine, Ayurvedic medicine. A lot of this, Natalie, is out of pocket.
Yes.
And it's very costly.
Yes.
And you feel so desperate, and not every family can afford to seek alternative care like that. And it's very hard to even source who are the best holistic doctors, natural hormonal health physicians, whatever you're even looking
They're out there.
They're out there. How do we make this more accessible, though, for your average female? And is this necessary? Should women completely abandon the traditional way of solving these hormonal issues? And how do they do the research? What is the most efficient way to find the best naturopathic holistic doctor to work with?
Right now, it is incredibly necessary. And there are organizations that are raising awareness outside of the federal government. And so Facts About Fertility, Natural Womanhood has great literature on the different natural remedies and methods. Institute of Restorative Reproductive Medicine. These are some great organizations that have really focused in on finding the best holistic medical professionals across the country and to offer those medical professionals to women. Unfortunately, because there is a lack of medical education, there's also a lack of medical professionals that specialize in this care. Yes. I've traveled to St. Louis for some of my surgeries. I traveled to North Carolina for one of my surgeries. We need to be training, and that's why it's so important. We need to be training medical professionals because we need more medical professionals to meet the need. Yes. There's a bottleneck issue right now. There's a lot of patients exploring the natural remedies, a lot of patients exploring minimally invasive gynecological surgery over something like ablation surgery, which is not the proper treatment for endometriosis. And yet there's a lack of medical professionals. So there's this bottleneck issue, and we need to make it more available. And that might mean creating lists of the medical professionals that specialize in each field. There are lots of things we can do to make this more accessible to the person that I was a couple of years ago, or you are.
Yes, and I was that very sick, young female. I went to the Mayo Clinic. I went to the Cleveland Clinic. I went to these so-called top institutions, Natalie, that every family would say, okay, I'm at my wit's end, and this is the last stop. Yet at these very prestigious medical institutions like the Mayo Clinic, they still don't have doctors looking at you as a whole person. They have the gastroenterologist looking at you for those symptoms. They have the cardiologist looking at you for those symptoms, but they don't have a way of putting the whole picture together because that's not what they've been taught. Yeah. So still at these very prestigious institutions, you're just being treated as a guinea pig, and you're treating the symptoms.
Yes.
So there's a lot of work to be done still as far as these bigger and larger institutions, the education, the incentives, and treating people as a whole body, as a whole person. And I think there's, of course, so much headway that we've made, but these conversations aren't all being had. Not everyone has traveled to these institutions or has suffered. As far as the struggling patient out there right now, all of this can be overwhelming. And when you have a sick child and when you are traveling to these different institutions and different centers, you are overwhelmed.
Absolutely.
And there's a plethora of information out there with the internet. What would your advice be to that struggling parent or that person that is just newly informed and trying to grasp all of the information and is overwhelmed?
Absolutely.
What would your advice be?
Reach out to people like me and other people that are speaking publicly about this. We're grassroots. We'll help you. We'll give you the information. I have people that reach out to me constantly asking, who should I see in this area of medicine? And then, like I said, there are organizations that have really worked on the grassroots, who have really developed a distribution list so that medical professionals and patients are able to access the proper information and seek the type of care that they need. I'll just add, especially with you were talking about chronic illnesses and how we need to look comprehensively at the body. This is where it really fits into MAHA, because someone who has a reproductive health condition or chronic reproductive health condition is likely to have 4 other comorbidities that are not even related to the reproductive organs because of the inflammation, because of the hormone imbalances. And so it's incredibly important that we look at reproductive health conditions and understand how it's affecting the rest of the body. And that's why holistic fertility care, holistic medicine is incredibly important. There are medical professionals out there that can help you. And there, like I said, Natural Womanhood, which is one of the organizations that works on restorative reproductive medicine, has a list of those medical professionals. It's available. We just need to be raising awareness about where that information is.
Right. It all starts with that, the awareness, the education. Again, giving our power back.
Yes.
To Americans, to women. And I think that's exactly what this movement is all
It's
about.
true femininity. It's true female empowerment.
And restoring that, restoring old school femininity, old school masculinity. That is also under the bracket of health and wellness. And I love that you just said that. Natalie, thank you so much for publicly speaking about your story and inspiring others, because I always say you never know what sharing your personal story can do for that one person in the audience.
Absolutely.
And that one female that's feeling so alone out there.
Thank you, Kaylin. These are the conversations we need to have.
Absolutely. God bless. Thank you.
Thank you.